Hi, this is Stephanie with Healthcare-Edu. We are located in Brockton, Massachusetts, and offer the nursing assistant classes for Massachusetts residents. So we are going over the skills as listed on the Prometrics checklist in order to pass the state exam. So prior to every skill, we're gonna do hand washing. If you haven't watched that video yet, you can go back on my page and watch it. So I've already washed my hands and I have gloves on. So now let's get our supplies. We need we need paper towels to make our clean surface on the bedside table. We need a basin. We need a water thermometer, soap. Okay, we're going to go in with 4 washcloths. The biggest thing with the washcloths, we are not making a mitt as we did in the partial bed bath video. We're folding it like so. This is a different way so that you have 4 different unique sides for cleaning the perineum on a female. If the class can be quiet so we can just record the video. We're gonna go in with Purell, with gloves. We have a towel. I've grabbed a hand towel because it's the perineum, or it could be a regular bath towel. And we're gonna go with a clean pad for the bed, okay? So what I'm actually going to do, I'm going to gather all of my supplies. I'm going to knock. For the purposes of the video, we won't pull the privacy curtains closed so they can record it. But in the test taking, I'm gonna pull the privacy curtain closed. Okay, I'm going to place my items on the chair. Hello, this is Stephanie. I'm your CNA today. I will be providing you with your perineum care. Can I see your 2 patient identifiers? Okay. And so I'm going to make my clean surface. We're going to make our clean surface here. Lay our items down on our clean surface. Okay, before I get started, I'm going to go and change my gloves. I mean, not my gloves, I'm gonna actually put water in the basin. So I'm gonna exit the room. I'm gonna go get some water, okay? I will hand hygiene, take my gloves off, hand hygiene, exit the room, fill the basin with water, hand hygiene, go back into the room. Knock, knock. I'm here with some water, and actually put the water basin on the table, okay? Now, for the perineum care, when I bring in the water, I want to check the water temperature. I'm going to check the water temperature. The temperature is within the appropriate measure for perineum care. And now I'm going to start my care, okay? So what I'm going to do, I have to raise the bed to my height. So I'm raising the bed to my appropriate body height. Okay, miss, I'm gonna lower the bedside table. I'm gonna actually roll you onto your side in order to get the soiled linen out from underneath you, okay? So my apologies, I have to be on the other side of the bed. I'm gonna have to roll the patient twice. So I lower the side rail. I don't have to fully expose my patient. I'm gonna bend the knee. The patient's gonna reach over as much as possible with an arm. One hand on the shoulder, one hand on, oh, sorry. Hold on one second. I'm going to roll the patient and actually roll the soiled linen, just like we did with changing of. I'm gonna roll underneath, the patient's gonna come back. And what I can do is go on the other side here, roll the patient, going to roll you there, and take out the soiled mattress pad, okay? I don't have it touching my clothing. I will put it right here in the linen hamper. Once I change the soil mattress pad, I have to change my gloves here. So I've hand hygiened. I'm gonna put on a clean pair of gloves. Okay? I'm gonna put on a clean pad underneath the patient. Roll the patient. Can I have you roll back, Tony? Tony can roll back. And what I'll do to adhere to proper body mechanics, I won't reach over the bed too much. I will come on this side and make sure that the pad is completely rolled out. So now Tony has the clean pad underneath her. So now we're going to start the perineum care. I'm just gonna fan fold my top sheet back. I'm gonna expose you a little bit so we can do the perineum care. Okay? So the perineum care, this is my soapy towel. I'm gonna put my soap on there, and I'm gonna make sure that each section I'm using a different part of the towel. So the outer labia, which is outer lips from top to bottom, make sure, because it's a woman. Then the inner labia, top to bottom, a separate side. This is all soap. The other side of the inner labia, top to bottom. Then the outside, top to bottom, okay? So that's a demonstration of how to use this. And you could also, if it was a real person, you put your hand like a C shape like this to hold open the labia so you could properly clean. That's soap. Now I'm going to rinse. This is just water, and I'm gonna do again the 4 parts. Outer labia, top to bottom. Inner labia on this left side, top to bottom. The labia are the lips. Inner labia on the right side, top to bottom. Outer labia, a major labia, top to bottom, all right? So it's 4 because of the female anatomy. Okay, so that's the soap, the rinse. And I'm going to pat down, dry. So you're not soaking the area, and I'm gonna make sure I pat dry on the inside and everything there. Now, sorry, my side rail should have been down on this side. So now what I'm gonna do is, prior to me starting the cleaning, my side rail would have been down. I'm going to turn you, Tony, to the other side like we did before. So once you get Tony turned to the other side, or your patient, you're gonna expose the area here, and you're going to do the buttocks. So actually, let me lie Tony back down because I have to change the water. So let me lie Tony back down. I'm gonna cover you here, and I'm gonna make sure I change the water, okay? So my side rails are gonna be up. The soiled washcloths that I did the front of the perineum with go into the hamper. I hand hygiene my hands, okay? So whenever you change water, you always take the washcloths associated with it, put it in the hamper, and then after Purell and hand hygiene your hands. So I'm gonna leave the room. I will be back, Tony. Let me lower your bed. So whenever you leave the room, you need to make sure the side rails are up and the bed is low and locked. So you have to make sure you leave in a safe position. Okay, I'll be right back. I'm gonna open the privacy curtain. I'm gonna go out, dump the water, get fresh, clean water, okay? Hand hygiene, come back into the room. Knock, knock. All right, I'm gonna close the privacy curtain to make sure that it's shut. Now I'm gonna go and put my gloves back on. You could hand hygiene from outside of the room. It really depends on where your supplies are, or just say it. But I'm gonna put my gloves back on. And so now I'm going to raise the bed again. Hi Tony, I'm raising the bed again for body mechanics. So I have the fresh, clean water. Once I raise the bed, I'm going to have to check the temperature again. Okay, I'm gonna check the temperature again. I'm gonna make sure the water temperature is within appropriate range. It is. Now I'm going to be able to roll Tony, roll my patient, turn my patient to the other side. Fix the pillow. Lower my side rail. Okay, and so now I'm going to clean the buttocks area. Soap. Okay, long firm strokes. You could do that method I showed you, or you can do a mitt here. Remember the mitt from the partial bath. So this is soapy area. Long firm strokes. You're going from front to back, okay? That's soap. Rinse. Rinse. Pat dry. I'm drying and I'm all set. I'm gonna turn you back onto your back, okay? A real person, you wouldn't be able to lift up like this. Cover with the blanket, with the sheet, the top sheet. Okay. All right, so I'm going to do all of my safety steps before I take care of the bedside table. I'm going to hand hygiene, put my side rail up, lower my bed. So I'm gonna make sure my bed is low and locked. It's locked, I'm lowering it. Do you want your head of bed up, Tony? I'm gonna make sure the patient's comfortable. So bed low locked, side rails are up for safety. The patient is comfortable. And the patient has the call light within reach. So all of my indirect skills are all set. That's your call light. And actually now you might have to come in twice in this step to make sure you take care of the bedside table. But I'm actually going to put everything else in the hamper, okay? I'm gonna wipe down the table. I'm wiping down the table, okay? I'm gonna leave with my supplies. Now, if you can also come back into the room to wipe down the table. All right, I will be back. Call us if you need us. You're all set. I opened the privacy curtain. Oops. I open the privacy curtain. I go to the bathroom, dump the water, wipe down my basin to ensure that it's clean and put back, stored away. I'm gonna put all of my supplies away. and I'm going to hand hygiene, and I'm done.